I'm Dr. Ben Brody. I'm Associate Professor of Clinical Psychiatry at Weill Cornell Medical College, where I oversee inpatient services on two of our campuses. And this presentation is about ketamine safety and the ketamine landscape as it presently appears to us in 2026. So the first is this patient appropriate for ketamine in terms of diagnostic consideration? So, do they have a treatment-resistant mood disorder, or do they have a mood disorder that is accompanied by acute suicidal ideation, such that ketamine might be something that is really, the right intervention? Other factors that should be considered are medical stability. If patients have uncontrolled hypertension, that would be a concern. If patients are actively abusing substances, that's a very tricky area because there is some research that suggests that ketamine might be particularly effective in that population, but there's also risks associated with exposing patients with substance use disorders to new compounds that are potentially substances of misuse. So that's a tricky area as well. The setting of ketamine administration is critical. So this is something that we're going to talk a little bit about during the symposium in terms of why in-person monitoring is so critical. And then making sure patients have a sense of what dissociative experiences are like, because they are unusual experiences. Many patients find them odd, but not especially troubling. There's a group of patients that find them pleasant and pleasantly intoxicating. And of course, that's why ketamine has the potential to be a substance of misuse. But through some of my work, I've also identified some patients who find the dissociative experience to be frightening and potentially terrifying, and some who have even expressed suicidal ideation in the context of ketamine administration. And so it's important, I think, for patients to know about the potential experiences they may have during the dissociative experience so that they can go into it informed. And those are things that we like to talk to patients about before ketamine is administered. So those are some of the major things that I think clinicians should be aware of and should be thinking about when they're evaluating patients for possible ketamine therapies.